part 2 of treating a swollen knee. We're going to start off the video again with some manual work with a little gua sha instrument assisted soft tissue work. Some people call this Graston. The idea here is to eliminate the swelling out of the joint line so the muscles could engage. Most people are unaware is if you have a swollen knee, muscles that are inserted to those regions of the knee joint, they just go into amnesia and inactivate. So the best way to recover from a swollen knee is eliminate the swelling via manual hands-on work and engage the muscles, and then follow up with a cryotherapy 10 to 15 minute session. So let's start off this video with a little education. I'm a big fan of educating the environment. Or in the more educated environment, the smarter environment. So the knee joint is composed of 4 bones. We have our tibia, we have our femur, we have our tibia, and then we have our fibula, and then the last bone is the patella, which is a floating bone. The muscles that function in flex and extending are the quads and the hamstring groups. Very simple. That's all the knee joint is composed of. So the first step in continuing on with knee recovery, we're going to use a little bit of instrument-assisted soft tissue work. Gua sha, as they call it, and Graston is another term for it. So what I've noticed after the first episode is definitely less swelling around the joint line, but still relatively, in my case, sensitive behind the knee near the calf region, and also more of the hamstring region. I don't have as much swelling in the joint line in the quad section, so I'm not going to spend as much time in the quad. I'll spend more time behind the knee in the superior calf and distal hamstring regions. And let's get started. So you need to lube up the joint line. I use cocoa butter with a little bit of coconut butter or oil. The idea here is making sure the tool doesn't, scrape you up. There are effects from using a tool, such as after the first session, I did experience a little bruising on the adductor side of my leg. So I'll probably stay away from the adductors. We don't want to aggravate the bruises even further. But the bruises can be signs of the swelling affecting the muscular groups. So a little refresher, anytime you're doing instrument of soft tissue work, gua sha, Graston, whatever you want to call it, you could even grab a butter knife if you don't have these instruments. With the quad, you do have to flex it a little bit because most people are unaware when your quad is totally straight or when your knee is totally straight, the quad is at its shortest. So we want to start creating flexion of the knee and start creating larger or smaller angles in the knee and having the knee less sensitive. So you'll have to flex it slightly and then start getting rid of the swelling from the joint line into the muscles, and the muscles will then pump it out of the system. So the technique is really blood oriented. With me scraping the joint line, I'm staying away from bony landmarks. I'm attacking swelling and regions where swelling could, build up. This is a really effective way I've noticed to treat the knee sprain. Instrument assisted tissue work, followed by exercise, followed by a little cryotherapy, and repeating it till you go back to the state that you were before the injury. If you went to see a therapist, they will be doing this for you either way, so you're just beating the professional you're pretty much doing what the professional will be doing it for you, but you're saving the finances. So now I spend a little bit of time on the quad. At this moment, I do experience more medial and posterior medial, posterior inferior, lateral restriction. So it's not necessarily that I can't bend the knee, but I feel sensitivity when I extend it in my hamstring groups. So I'm just spending, with the hamstring groups and the back region, you have to completely strain the leg out. So if you had somebody else doing it for you, you'll be on your stomach. The more frequently you perform the instrument tissue work, the more of a professional you become for yourself. It's the rule of time. The more time spent, the more you are understanding of what you're trying to do here. You really start feeling out where you have restriction and swelling. The tool has really been designed to save your hands. You can perform the edema, bringing the edema down, which is a fancy term for swelling, with your hands. But eventually, your hands wear out, and the blade's been designed so you can save your hands. Just changing angles, that's what it's really about. But like I mentioned, to get the hamstrings of your leg, it kind of needs to be a little bit more straight. And to work on the quads, your knee needs to be flexed. So those are the little extra tricks that I learned. I'm passing on to everybody who's watching the videos. And after spending about a few minutes, we want to advocate the exercise and engage in the muscles that help the knee flex and extend, because the rubbing that you're performing here, you're sending the swelling into the muscles. And then when you start exercising, the blood starts circulating and swelling out of the system via heart. So that's why exercise is a big prescription in knee rehab. Can't just do the hands-on work and manual, because you'll be missing a piece. It isn't a perfect, so I sometimes after you're rubbing a little bit, take your hands and feel, if you feel any parts of the knee where it might be a little bit more juicy, as I like to say, just which is the edema sticking around. There is minimal, so your joint line has some space to spin, rotate, and glide, which is your femur doing above your tibia, on the meniscus. But when they're swelling, there's no space for the femur to spin, rotate, and glide. So that's why when you have a swollen knee, it's almost impossible to flex the knee because the joint, or the femur, doesn't have anywhere to spin, glide, and rotate. And that's what happens when every time you flex and extend your knee, your femur spins, glides, and rotates. So we need to get the swelling out of the joint line via these instruments and exercise and cryo after you're doing all this, because it's impossible for the femur to recover if you don't get the swelling out. It's like the flooding in a basement. Can't get the house to get repaired if you can't get the swelling or the water out of the basement first. Can't work on the remodeling if you have the swelling still in the basement. So that's my silly analogy with using an instrument and improving or getting rid of that swelling, edema, out of the joint line. Compared to a few days ago, I'm feeling so much better. It's still not 100%. I still have some limitations, and that's why I decided to create this part 2 of this video. And most likely I will create a third part to finalize the 3-step, or more like, because it's a gradual increase back to activities of everyday living. I'm not the youngest chicken in the world anymore, so all right. So once you're rubbed, you want to spend anywhere between 10, 15, 20 minutes rubbing the tissues out. You will get some redness. Next day effects can also be a little bit of a swelling, but that's okay. So we're going to start with the foundations again. So you're going to grab a towel, roll it up a few rolls, and then you're going to set yourself up on your back, or with the towel underneath your knee, seated or lay back completely. So the goal here is to engage the quads that are the knee straighteners. 2, 3, 4, 5, and then relax it. The goal here is to engage the quads, have minimal to zero joint pain. 2, 3, 4, 5. 15 repetitions. 1, 2, 3, 4, 5. Very simple. 1, 2, 3, 4, 5. One more. 1, 2, 3, 4, 5. Isometric holds. They're called quad sets. They're just helping to pump the swelling out of the joint line, but they are the knee stabilizers of the knee. 2, 3, 4, 5. They are the extenders of the knee. 1, 2, 3, 4, 5. Like I mentioned, can I squeeze the quad, minimal to zero joint pain, feel a contraction for 5 seconds, and then turn the light switch off. So you shouldn't just, this isn't how fast you do these. This is really technique oriented, making sure you really create a healthy and strong joint. 1, 2, 3, 4, 5, and relax. Squeeze. 1, 2, 3, 4, 5, and relax. Squeeze. 1, 2, 3, 4, 5, and relax. Squeeze. 1, 2, 3, 4, 5, and relax. 1, 2, 3, 5, and relax. So that's our first one after the 2 work. The second exercise requires a foam roller or something just to prop up your knee. The idea here is now get 15, 20 degrees of flexion, from flexion to an extension. Short arc quads, so a few degrees. So the first of 2 is, first one is I'm using my other foot. I'm going to raise my foot. I'm going to hold it. 1, 2, 3. Let the foot drop. And that's going to work. So I'm using other foot as assistance. I'm going to raise the leg up to it's completely straight. This will engage. Then can they hold? 1, 2, 3. Let the leg drop and make sure the muscles shut off here. Opposite leg assistance to the highest point where you feel the quads engage. Hold. 3, 2, 1. Nice and smooth and controlled. Help assistance getting the leg straight. Hold. 3, 2, 1. Let the leg gravity lead you down while you control. You're going to do a set of 10. Hold. 1, 2, 3. Let gravity lead you down. Isometric work. Isometric work here. 1, 2, 3. And then eccentric lowering, lengthening this. Squeeze. 1, 2, 3. Back down. Raise the leg. 1, 2, 3. Slowly down. Make sure the muscles in your quad or your anterior here are shut off in between repetitions. After a knee sprain, they don't have the endurance to do one repetition after another. That's why I'm really advocating things to shut off. So you can't just go one and keep doing this, because I don't feel the muscles here at all. I actually just hurt my joint a little bit right there. So this is really about connecting the muscular groups with the neurological groups and getting away from having knee pain and having muscular contractions and creating this homeostasis. So can I have pain-free movement? 2, 3. And then develop those muscles for longevity. Raise the leg, hold. 1, 2, 3. Back down. Use the other foot. Raise it. Hold. 1, 2, 3. Back down. Lift the leg. Hold. 1, 2, 3. Back down. And last one. Lift the leg. Hold. 1, 2, 3. Back down. Second part of this using a foam roller is lifting the leg. So now from this degree, can I get it back to 0? 1, 2, 3. Let gravity lead you down. So it's about 15, 20 degrees of flexion. And now can I raise the knee foot up into 0, which is your joint line being straight. For 3 seconds, feel these. And let gravity lead you down. Make sure they shut off. Squeeze. 1, 2, 3. Shut off. Squeeze. 1, 2, 3. Back down. Relax. Squeeze. 1, 2, 3. Lower the heel. Relax. Extend. 1, 2, 3. Lower. Relax. Extend. 1, 2, 3. Lower and relax. And that's our second one. Third exercise is a complementary exercise, making sure the femur bone rotates, but the engagers are your pelvis groups. So they're more of the rotator, the deep rotator glutes. We have the piriformis, then you have the superior gemellus, then you have the obturator internus, then you have the inferior gemellus, then you have the obturator externus, and then you have quadratus femoris. These 6 rotator cuff muscles deep inside your pelvis is the first layer of your glutes. The second layer is the glute maximus, medius, and minimus. These all play together to move this bone. When these work, they are complementary muscles that help the knee in hitting the ground and stabilizing. So the goal here is to bring the knees up to about 45 to 60 degrees. Make sure your knees are not too flexed. Hip is not too hiked up. And there's a 3-part series to this. So first one is relatively easy. You're going to raise the knee, raise the ankle, lower the ankle, lower the knee. Make sure the top femurs are nice and long. Make sure they're stacked level so we don't have any SI discomfort. Knee, ankle, ankle, knee. 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 2 more. Knee, ankle, ankle, knee. And 1 more. Knee, ankle, ankle, knee. That's the first one. Second one is slightly different. You elevate the feet, but nothing changes. Nice and long in the levels. Don't hike up and open. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Feet down and relax. Part 3. You raise an ankle and knee. 1, 2. Back down. Ankle and knee. Back down. Make sure you feel the glutes. 1, 2. Back down. 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 And let's go 1 more. Lost count actually. 1, 2. Back down and relax. Very nice, very nice. Next exercise requires a towel and a wall. This is another glute exercise. These 4 exercises for the glute are, like I mentioned, a complementary muscles that help out the knee in ambulation. So every time your foot hits the ground, this muscle helps up picking up all the forces of walking, jumping, lunging, and just general ambulation, like I mentioned. So the better this works, less sensitive this can also be. This exercise requires you to have a towel and lay on your side against the wall. So we're going to use the towel as a biofeedback. So what I mean by that is your job is to be nice and long in the top leg, long axis. So sometimes when we lay on our side, we make the top leg shorter than the bottom leg. So make sure if you glance at your feet that the feet are as stacked, not shorter than the other. Next part, you're not arching your back, you're not flexing your arch. So no lordosis or kyphosis, changing your spine, midline stabilization. Kick the heel into the towel in the wall, and then raise it as high as you can. Hold it, 1, 2, 3, and gravity will lead you down. Make sure you're always having wall contact, and at the highest point where you're counting that 3 seconds, you should feel your butt. 1, 2, 3, that's 2. Make sure the legs are long. You're not hiking. You're not arching. And then the last part, you're feeling that butt. 1, 2, 3. Back down. Raise the leg. 1, 2, 3. Let gravity lead you down. Nice and tight in the waistline. Kegels. Belly button in. 1, 2, 3. Back down. No holding breath. Belly button in. 1, 2, 3. Back down. 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 2 more. 1, 2, 3. Back down. So a little refresher. Knee is straight. You're pushing into the heel. Legs are level. No hiking, no arching. And then feeling that butt with knee stability. 1, 2, 3. Back down. Knee stability. Leg raise. Butt activity. Fantastic complementary exercise when someone is recovering from any kind of knee sprains. So, once we are done with the wall slides, the next step is, let me show you guys. Next exercise requires a band. We're going to use the band. We're going to place it around our knee. These are called terminal knee extensions. So the idea really is teach some of the foundations, non-weight bearing, and then start transitioning into weight bearing exercises. Once you have minimal to zero pain in the non-weight bearing exercises, you need to start transitioning into weight bearing exercises because the knee joint is a weight bearing. All 4 of the bones are weight bearing joints. So you need to start teaching those properties to those bones and those muscles. Another phenomenal exercise is this one. The idea here is to be staggered positioning, level pelvis. You're going to be on your toe, and you're going to try to push the heel down, which will cause the knee to straighten out. You're going to hold it. 1, 2, 3, 4, 5, and then let the band bend the knee onto your toe. So terminal knee extensions. 1, 2, 3. Really teaching that transfer over to ambulating and moving. Squeeze. 1, 2, 3. Onto your toe. Squeeze. 1, 2, 3, 4, 5. Want to feel the contraction? You need to push that heel down. Pushing the heel down will be a domino effect and it will engage the quads. Your job is to hold it there, not sacrifice any weight distribution. 1, 2, 3, 4, 5. Push the heel down, straighten the knee out. 1, 2, 3, 4, 5. On top of the toe. Push the heel down, straighten the knee out. 1, 2, 3, 4, 5. Feel that quad contraction. Still have some pain, that's okay. But making sure the knee or pain doesn't drive up as you do these. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. We'll go 3 more. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. And here's the last one. 1, 2, 3, 4, 5. All right, next exercise requires some pad of unlevelness. We're going to use an Eric's pad. And the idea here is you want to have a knee or straight knee and try to withstand a 30-second balance. 2, 3, level pelvis. 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, and switch. If you're struggling with the balance using a stick or wand or some kind of foam roller near you, can't help out. But if you feel pretty good, try not to use anything. But really, you're just emphasizing terminal knee extension. So knee straight, what you did on the table, and it can keep the knee straight and react to the unlevelness and forces that taking me off balance. 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 9, and 30. We'll do 3 sets, 3 30-round sets. I'm a big fan of just alternating, giving the leg a chance to recover. When you're standing on this pad, make sure the pelvis is level, you're not curling your toes. You'll never be totally still, the world's spinning, you're breathing, heart's pounding. So there's the hermetic principle, everything is always at a vibration. 2, 3, 4, 5, 6, 7, 8, 9, 10. If you lose your balance, that's okay, just regather. This isn't there's no lashes we want to create a healthy, strong joint that has no pain. So if you're having discomfort around a 20-second marker, step off and then try to continue. But ideally, you should have the skill set, and it is one of the most impactful skill sets as you get older, your ability to stand on one leg, which is actually after the age of about 45, increases mortality rate. So if somebody who has the inability to stand on one leg has a fall, has a big injury, creates a sedentary lifestyle, and it starts creating that snowball effect into mortality. So it is actually one of the most impactful things as you get older is your ability to stand on one leg and not lose your balance. So if you could develop that skill, that's great. It puts you in a position to succeed and not have a fall. 2, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. We're going to go one more round. So a lot of this is calf work, ankle work, with your ability trying to keep the leg straight via quad. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, and relax. If you don't have a pad, stack up some towels, grab a couch cushion, go stand on the grass, or if you have some sand, something on level which make you forced to react. Knees straight, figure out the weight distribution. You're never still, like I mentioned. World's spinning, you're breathing, heart's pounding. So you're always at vibration. You're always a sudden, movement. You might not be feeling it, but it's always a subtle vibration about you. And that's the balance work. Next exercise requires a Swiss ball, and we call these hamstring eccentrics. Let me adjust the camera for you guys. So we're going to use a ball. We're going to set ourselves up on our back. So the goal here is to create a 90-degree angle with the heels on the ball. The first step is raising the hips up. Once you feel the butt working, your goal is to extend the knees as slow as possible. Feel that quad work. Lower the hips. So these are hamstring eccentrics. They're phenomenal in flexing and extending the knee and building those muscles for that function. Your responsibility is really to, one, feel the butt when you raise it, and then go 3, 2, 1. Toes are pointing up. Feel the quad work when you fully extend, and then just lower the butt. Very simple. Bend it to as far as you can. 90 degrees, no more or less. I mean, less is okay if you're having difficulty getting to the 90 degree range, but make sure you raise the hips up, extend slowly. 3, 2, 1. Toes pointing up. No out, no in. Keep them still. Pelvis down. Set yourself up. Belly button in. Nice and tight in the waistline. Hips up. Feel the butt. And then extend as slowly as possible. Feel those hamstrings. And back down. So we're working on hamstring eccentrics. Will help with the knee flexion. So hips up. Extend. 3, 2, 1. Feel the hamstring work. And ultimately, it's going to help increase range of motion and strength levels in flexion. Up, 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 up. Feel the butt. Feel 3, 2, 1. Squeeze the quads. Lower the pelvis. Up, 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 up. Extend. 3, 2, 1. Feel the quads. Lower. Go 3 more. Hips up. Feel the glutes. Extend. 3, 2, 1. Butt down. 2 more. Hips up. Butt engagement. 3, 2, 1. Nice and down. In control. Last one here. Not easy. Hips up. Feel the glutes. Extend. 3, 2, 1. Down and relax. And that's part 2 of our continuing to show you guys how to rehab a aggravated meniscus tear. So once I'm done with all these, which I'm not going to show in the video, is now I'm going to wrap my knee with ice for 10 minutes. And that's going to just be the complete, I like to use a soup analogy. The soup is great when you do everything together, and also the knowledge of the chef. So you're not going to just chop up with the potatoes and veggies and then walk away and then come back. What I'm trying to say is everything needs to be done all together. The manual work first to eliminate the swelling. Second part, engaging the muscles that help flex and extend the knee, which also will get the swelling out of the joint line. And the third part, topical, nice and cold. You could do a cold plunge in a tub, or just wrap the joint line with ice. And that's the secret to recovering from a aggravated knee injury. I hope you guys liked the part 2 of this. Look out for part 3 in a few days. And we're going to just continue on the progression and show you how to take care of yourself after you aggravated a knee. Please like and subscribe. Reach out with any questions. I hope you like part 2. Look out for part 3.